So hello everyone and welcome to this press conference for the COVID update in Quebec. The Premier of Quebec, Mr. François Legault, is together today with the National Director of Public Health of Quebec, Dr. Horatia Arruda. Mr. Legault. Yes, hello everyone. Before going over the numbers of the day, I'd like to get back to what I would call the evolution of the guidelines. We know this pandemic evolves. The control of the situation also. So it is normal that the guidelines evolve. It's not because we're changing our minds. It's because we are adapting ourselves. And I'd like to give you a few examples. At the beginning, when we saw that the pandemic was accelerating, we closed down, amongst other things, businesses, schools, daycare centers. Now that we see that in regions outside of the Greater Montreal area, the situation is stabilizing and is under better control, well, we are reopening the schools, the daycare centers, and the businesses. I'll give you another example. The caregivers, at the beginning, especially with the problems that we encountered in CHSLDs, we refused that caregivers go visit their parents, for example, because we wanted to limit the spread of the virus. Now a phenomenon took place. After 2 months, it's a bit normal that a lot of anxiety in certain people in those residences was created. Some even started refusing to eat because they were used to every once in a while seeing their children. So in the balance of inconveniences, the situation evolved and we decided to give access to caregivers to be able to go see the residents. So that is a situation that evolved. Another example, people 70 and over, I'll remind you that even at the beginning we were telling people 70 and over to not go out. And after that we said, well, just be careful, have your grocery stores, have your groceries be bought by other people. And we set up guidelines, such as keeping 2 meters. And public health, in a very independent way, decided that now it was all right, it was acceptable that people people from 60 to 69 years of age, go back to their regular activities while maintaining that 2-meter distance that is starting to be pretty much in people's minds. The situation is evolving and we adapt ourselves to it. Now there are people, I've heard, people say that we are sending back the children to school, but we don't have the time. We don't have the right to get together as a family. What's the difference? The difference is we have to go gradually. If we start everything all at once and allowing everything, there's going to be a much higher risk of spread. So eventually, I hope, as quickly as possible, we will allow gatherings again so that families can get together. But for the time being, what we're saying is we're reopening the schools because schools are important. It's an essential service for the children. We are not yet at family gatherings because it would be too much deconfinement at the same time. So that's what it is. It's not a question of changing our minds. It's a question of going gradually. It is a question of adapting ourselves and of also looking at how the pandemic is evolving in each area of Quebec, because the situation is not the same. If you're in Montreal, outside of Montreal, it's not the same. So we are adapting ourselves, and I'm going to announce something to you in the next few weeks. We're going to continue adapting the guidelines and to have them evolve as needed. This being said, the numbers of the day. Yesterday, there were 85 deaths. We're a total of 3,013. My thoughts, of course, go with the families and loved ones of those victims. And just to show you a little bit how the situation is different in Montreal from the outside of Montreal, out of the 85 deaths, 82 took place in the Greater Montreal area. So we can see that truly, on the one hand, the situation is very difficult, and on the other side, the situation is easier. We now have 38,469 cases, an increase of 748. Taking into account, and I'll get back to that, but taking into account the important increase in testing, it is still a decrease. We also have to remember that we have at least 9,700 people amongst those 38,000 who are cured. So, as we have already explained to you, we do not test all the people who are cured because we prefer concentrating on the people who have symptoms, but we have at least 9,700 who are cured. In our hospitals, yesterday, we had 1,838 hospitalized people, an increase of 7, 193 in ICU. That is a decrease of 6. The other question that I hear a lot, because I was reading a little bit what it is that people are writing, I spoke with a lot of people over the weekend, of course, and the question that keeps coming back is, why do we have more deaths in Quebec than in other places in the world? I would say that there are 3 main reasons. The first one, the school break, the spring break. In Quebec, it took place at the very worst moment. So a lot of Quebecers went traveling, they got the virus, they came back, they transferred the virus, they gave it to other people who gave it to other people who gave it to other people. And so it is that already that didn't help us a lot. It didn't help us at all. That's the first reason. The second is that in Quebec, and it's always been the case, even when there was a lot of heat, we declare every death associated to a disease, a virus. So we are reputed as being people who declare, even through association, when somebody dies in a CHSLD, if they were linked to somebody who had COVID-19, that person is put in the calculations as being COVID positive, and that's not the case everywhere in the world. And the third reason, and now we're all responsible for this, all governments, and I'm not trying here to deny and to pretend, not take responsibility, but we were not well prepared in our CHSLDs. First, there's a question, and there's an issue, a societal issue that we have in Quebec. We have a lot more elderly people in long-term health care centres if we keep to the proportions, many more than elsewhere in the world. That is a societal choice that we made. A lot of our parents and of our grandparents end up in CHSLDs more in Quebec than elsewhere. And we're going to have to review that because it is something that we're going to have to think about. Secondly, people were underpaid in CHSLDs. So in private CHSLDs, it was $13 an hour, and in the public ones, $21 an hour. These are not very high wages. The result is that a lot of the staff is part-time, and a lot of the staff was going from one CHSLD to another, so from one center to another. So that, of course, because perhaps there was slightly less qualified staff that got the virus and brought it to different residences. So on that end, we have a mea culpa to present. All governments, and once again, I don't want to blame others. I am taking my share of the responsibility. We were badly prepared in our centers for long-term care, and that is one of the reasons why we have more deaths. You saw it on Friday or over the weekend. The National Institute for Public Health made 2 studies public, 2 predictions. First, I do want to, specify it. It's not me and it's not the government who decided the date and the time that these studies were going to be published. I know that some people said, well, why Friday afternoon? Should they have waited until the Monday morning? Perhaps people would have said, well, why are you, sitting on this study for 3 days? Anyway, so they published them at the time when they were ready. Those 2 studies get to the same conclusions. First, one good news and one bad news. Regionally, that is to say, outside of the Greater Montreal area, the situation is under control. So that is an important conclusion for what will follow. However, in Montreal, the situation is not under control and is worrisome. And I want to be very clear on that. We are all worried with the situation in Montreal. I'm the first to be worried. So there are not some who are more worried, others that are less worried. We're all worried. And when we look at the predictions of the INSPQ, what we can see is that if there were confinements, there would be a major risk of explosion of cases and hospitalizations if there was deconfinement. So that is why we took the decision that businesses, schools, daycare centers will not open in the Greater Montreal region before the 25th of May. And it is not impossible that it even be pushed to later. It's not impossible that schools, we decide that in the Greater Montreal area, they only reopen in September. But we are going to be following science. We're going to be following the results. We are not going to take any risks. But if the situation is not under control in Montreal, we will delay the opening of businesses, schools, and daycare centers. We are all in agreement with that, whether it be the specialists at the federal level or the provincial level or the municipal level. We are all worried about the Montreal situation, and we're following the situation very closely. Now, in order to eventually think of deconfinement, one of the key aspects is to test more. Well, in about a week, we succeeded in going from 6,000 tests per day to 10,000 tests per day. It still isn't enough. We have to increase more than that. And that is why we adopted over the weekend a decree to ask certain groups of professionals, for example, the dentists, dental hygienists, to be able to take the samples. So we are going to have more people to be able to have tests. So we're thinking that over the next few days, we will be able to increase the number of tests and to follow the situation, whether it be in regions where we want things to stay under control, and Montreal, where we want to see where the situation ends up improving. Now, of course, the great challenge that we have, particularly in Montreal, is the staff. I'm happy to see that there's a few hundred employees who have started coming back within the network over the past few days. We hope that this will continue. And I'm still calling out to people, all those who have finished their quarantine, all the people who had the virus, and now they spent the time that they were supposed to spend isolating themselves. Please come back. In the network, we have people who are tired. We have people who need to rest. And so we need reinforcements. Now, I also wish to say that as far as the soldiers are concerned, we're now at 780 soldiers in CHSLDs. Not all in CHSLDs. I think that there's maybe 200 who are supervising outside CHSLDs, but still, that comes and helps out quite a bit. And I wish to thank the Canadian Armed Forces. I know that they want to increase that number to 1,350, and that is welcome, obviously. My daily thanks are for all those who organize the two great En Direct de l'Univers on Saturday, Saturday and Sunday evening parties, and Une Chance comme ça at TVA and Télé-Québec. That was really great. It was great to see our great Céline Dion, Ginette Renault, Jean-Pierre Ferland, Claude Dubois. I'm forgetting some, Gilles Vigneault. I was super happy to see him. He looked like he was feeling good. And Marc Labrèche was very funny, as was Mariano. That really made my evening on Saturday. And all the groups of young people as well, who myself personally, I don't know them as well, but I think that it was great for the young people to see younger groups. And it shows that we have succession coming up and we have talent in Quebec. So thank you to all the artists for having done something that made us feel good. It's a good thing that we have you. And some news for you as well. I was just given the numbers. You know, last night there was for the Les Petits Frères who take care of those children who are alone, and the organizations that care of family violence. There was a collection for donations, and Quebecers always surprise me. $2 million in donations were given by Quebecers for those two causes. Thank you to all Quebecers for, once again, this great generosity. And to end with a message. Maybe it's for those people who are outside of the Montreal region. I also heard a lot of things over the weekend, people who don't live in the Greater Montreal area who are scared that people from Montreal will go in the regions where they live. First, it's important to say it. If we say 2 meters away, as we're doing right now, there's no danger that somebody from Montreal will come and infect you. If there's too much movement and there are too many people from Montreal who go into the other regions, we won't hesitate, together with Dr. Arruda, to emit guidelines in order to prevent those movements. But I don't want Quebecers to start arguing and getting divisive between Montreal and the rest of Quebec. We are all in this together, in the same boat. We all are going to get together 2 meters away, but we are going to help one another out together, all Quebecers. So I wish to thank all Quebecers for their solidarity. I'm counting on you. Thank you very much.
Now, a few words in English. Good afternoon. Last weekend, the INSPQ published 2 studies that show the situation in Montreal remains very fragile. That's why we've delayed the reopening to May the 25th. And we'll proceed on May the 25th only if all conditions are met. The 2 studies also show that the situation is under control outside of Montreal. That's why we reopen businesses, and we are reopening this week schools. Regarding the staffing situation in our health system, we already have some reinforcements incoming, but we still need more. As such, I ask health workers who tested positive and have since then recovered, please come back. We need you. In closing, everybody must continue to keep their distances. I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier, for the question period. We are now going to be starting in French.
Bonjour, Monsieur le Premier ministre. Bonjour, Dr. Arruda. Monsieur Legault, vous êtes...
Mr. Legault, you are a very experienced political leader. You know that one of the oldest practices in the manual for politicians is that when we want for news to not be well covered is to reveal it on a Friday afternoon. How did you react to the appearance of these 2 important studies by the INSPQ last Friday at the end of the afternoon? Well, first, I looked at it Friday afternoon as well. I was made aware of it then. So it is not the government who decided to publish it then. That was the INSPQ is independent, and they decided that they were ready to publish on Friday afternoon. As I was saying earlier on, if they had not published then and they had kept it until Monday, some people would have said, why did they sit on the study for 3 days? It is the INSPQ. They're not political. They're scientists. They're experts. And they were ready to publish on Friday, and they published on Friday. And it might not have been ideal, and that's why we talked about it with Dr. Arruda to perhaps have an explanation session over the next few days so that you'll be able to ask all your questions. But myself, I looked through it on Friday afternoon and read it over the weekend. I didn't get it before you guys did. I understand that the INSPQ acts with full independence, and it doesn't, ask the government to to know when to appear. But do you agree with the request of the Parti québécois to indicate publicly whether the recommendations they're emitting are followed in their integrity or partially or not at all by the government? Up until now, all the recommendations that I've emitted have been followed. I think that they have been followed. There's been discussions. There's been scenarios that have been analyzed. You'll understand that right now we are in a situation that is completely new. It is emerging. The literature indicates all the decisions to be taken. Those studies don't necessarily exist. But up to date, the recommendations that we have made have been followed. The Institute can give us elements, that's clear. And after that, what we do is do a risk analysis, and the risk managing is made by the decision makers. For example, me as a national director, and up until now, I've exerted my role completely, freely, and independently. This morning, many children went back to school. Professors, educators, I'd like to know how many tests are going to be done today and how many were there for the metropolitan area of Montreal and how many for the outside. Well, listen, the tests were divided into different categories. I'm going to talk to you about the community perspective, if you'll allow me, not the one that is in link with the healthcare settings, because we have a capacity of 14,000 tests. Fluctuates. Weekends, it tends to decrease somewhat because people are not there as much. But in terms of the community, what we're targeting for the Montreal area, within Montreal, is 3,000 tests associated to what I would call community interventions in the metropolitan area. Plus, that's 3,000 from Montreal, plus 80% in the Montreal area. So those are the tests that we have right now. We saw school boards and professors take the temperature of the children before they went in this morning. Is that useful, necessary, and are we going to see a separation between the private schools and public schools in the management of the virus over the next few weeks? Well, listen, the protocols that we have been applying don't recommend, taking the temperature unless a child shows obvious symptoms, that they don't look like they're feeling well, that they have a fever, because fever is not necessarily an indicator that that's what it is. And secondly, there's a lot of debate scientifically around that because, of course, in airports, it's something that is practiced as a screening method, but the scientific evaluations, it doesn't hurt as such, but I think that it's more keeping an eye on symptoms as such that is going to be the issue. And somebody can be completely asymptomatic, and we know that they could still, have it. So taking the temperature is not necessarily recommended. Hello, Mr. Premier. I understand that you looked at the new projections from Public Health published on Friday, and I also understand that you are not going to be making any decision if it's too risky. But in light of the conclusions that are pretty disquieting, we're talking about a number of hospitalizations that could surge in Montreal, of deaths outside of CHSLDs that could increase significantly. Why not suspend that idea right away of opening schools and businesses on the 25th of May, saying, we're putting that date on the back burner? Because a lot of people seeing that date are very worried. They're wondering whether there isn't a pressure to accelerate the deconfinement. Why not just put everything on pause? The objective of putting potential dates is to give people the opportunity to prepare themselves. It's not that simple to open a school. It's not that open to open a business. So we wish to give a calendar that is tentative. And we know that other sectors, restaurants, tourism, hotels, showrooms, would like to have potential dates. But those dates seem to be further. So we don't think that for the time being it is worth to, have tentative dates. But for schools and businesses, we thought that it would be a good idea that people get ready. Once again, we are going to be following the situations. And yes, whether it be the studies made by the INSPQ, and we took the decision before even those studies, so all the numbers that Dr. Arruda has given us has been giving us for the time being. The situation is not under control in Montreal. It is unsettling in Montreal. There is no question of opening the schools and daycare schools or businesses before the 25th, and it's possible that it be even delayed further if the situation does not improve. Yes, I heard you reiterate the total independence of public health. Still, many voices have asked for a greater, perhaps, appearance of independence. I mean, we see you both sitting together every day. Sometimes the line isn't always very clear on what the recommendation of public health is, on what the decision. People are talking of perhaps having separate press conferences. Shouldn't we more clearly separate in the messages and the communication what comes from public health and what comes from the government? Well, first, what I'm telling you is that public health is independent. First thing, that's clear. I'm telling you that. Dr. Arruda is telling you that. Maybe there's a group of opposition that may not believe it, but I think that it's useful that we both be here at the same time, because some of your questions, and you've seen that since the beginning, are more to me, but other questions are very technical, and I'm not a doctor. I'm not a specialist for public health. So there are questions that you ask, and I think that for you as well, it's more efficient to have both of us here at the same time. Thank you.
Monsieur le Premier ministre, bonjour, Dr. Arruda. Monsieur Legault, on a l'impression que vous avez...
Mr. Legault, we have the impression that you have a lot of hesitation in confining the Montreal region further, because during the entire crisis, the regions were isolated, but Montreal as a region was never isolated. People were allowed to move around, but it had been evoked at the beginning, the possibility. At the beginning of the pandemic, around mid-March, there was a question that perhaps it could be done even in certain neighborhoods, etc. What is preventing you to be stricter with Montreal people? That's where the pandemic is, over there. You haven't stopped saying it, Mr. Arruda, as well. Mr. Arruda even said elsewhere in Quebec, it's paradise. It's heaven. The problems are in Montreal. And we have the impression that it's just in Montreal where there's no confinement. Well, listen, I've tried to explain it earlier on. I can try again. First, every day, including this morning, I asked Dr. Arruda, do you think that it would be a good idea to confine the Great Montreal area? And public health tells me for the time being no. So we have to base ourselves on science. And first, that was first. And second, perhaps in a month, we closed, or 2 months ago, we closed certain regions. What that meant is that the people from Montreal weren't allowed to go to those places in the northern areas of Quebec. So we closed Quebec in two, split it in two. Now we think that today is not necessary, but I was saying early on that will evolve, and it's possible that public health will tell me tomorrow or in a week, well, it might be a good idea to confine Montreal. But we are following the indications of public health. There are inconveniences as well to closing down regions. There are people who have parents in certain places, who live in different regions and who want to get together while respecting the 2 meters. So I also think that with the 2 meter rule that is more and more being followed, I think that in a region outside of Montreal, we shouldn't be scared of having people from Montreal come. And eventually, with international tourism that is going to go down quite a bit in the next few years, I should hope that the Montreal people are going to be welcome in Gaspésie and in the Laurentians and in the Estrie region, while maintaining guidelines such as the 2 meter distance. We are a people. Well, I will use my follow-up question to go to Mr. Arruda. See, isn't it useful that we're both here together? Mr. Arruda, you were very strict on Friday in your words towards Montreal people, saying, you have to respect the rules, otherwise we're going to, spank you. Mr. Legault says you were asked the question, you're saying that for the time being, Montreal should not be confined. What would be required for it to be done, and why not confine certain sectors that are hotter zones in the city of Montreal to prevent for there to be a transmission outside? Well, there are effects to confinement. First, you have to understand that when we talk about Montreal, there's Laval, and the South Shore and the North Shore. So that's an entire area, an entire society. There's a lot of flow of people between those regions. Now, we're not comparing, like the Gaspésie and the other regions around. It's like a societal whole. The indicators, first of all, you have to also understand that the situation is fragile, especially in CHSLDs and RPAs where the situation is like that. There is community transmission, that's for sure, but we are at an R0 that is at the limit of 1. That means that there isn't an amplification in the community. If we were to deconfine on the 25th, we'd have to keep an eye on that. And I would also like to say that scenarios are a very important element in the decision-making process. There's a lot of uncertainty depending on the model that we put in our predictions, but it gives us an idea of what it might look like. And it does not take into account the other measures that we'd be setting up if there was a deconfinement, which is, the search for cases and contacts. But what I can say in relation to that is that it will be the 6 criteria of the World Health Organization that will be used, regardless of whether the scenario is there or not. If the hospitalizations do not decrease, if we show that there's active transmission that we can't control anymore, if the hospitals are overloaded, we won't deconfine. But to confine the Montreal area, we would have to show that there is truly an active transmission. So, there's an R1, we're not going up like that, and hospitalizations are stable, intensive care are just starting to go down. We are not at the deconfinement criteria, but we're not also at the total confinement criteria. Thank you. Hello. Mr. Legault, you were congratulated and have been a lot for your efforts of communication and transparency. It's been saluted by everyone. But we do feel a change that started. You said that you became aware of the INSPQ predictions on Friday. But why didn't you feel the need to talk to the population under the circumstances with the new deaths that are still, in the hundreds? I mean, it appeared Friday. It worried everyone. Why up until now had you not think that it would be a good idea to talk to Quebecers over that period of time? Well, listen. I meet Quebecers through you 3 times a week. So that's not, negligible. The results of the study by the INSPQ confirmed what we had been saying already. In the preceding press conferences, said that the situation is under control in other regions, but not in Montreal. And that went along with the announcement that we have already made of delaying the opening of the businesses and schools and daycare centers in Montreal to at least the 25th of May. So there was nothing new, nothing, special. You talked about the worrying preoccupation because of the pressing need for staff, the care staff in Montreal. Now there are military. You said that we're now at 780 military personnel in the CHSLDs, but I imagine that they're not going to stay for years either. How long are they going to be there for, and what's going to happen after? It's part of the discussions that we're having with the Canadian Armed Forces because they have a way of working where somebody, when they come to help in a task such as this, usually it's for a period of 28 days, and after that they leave. So some people have already been there for a week or 2. So that is one of the concerns that we have. I would like to keep them until the crisis is over. So that's part of the discussions that we're having with the Canadian Armed Forces. And as I was saying earlier on, what I wish is that amongst the over 11,000 employees who are absent, that there be a part, thousands who come back because their quarantine will be over and because they can come back and work. And there are people who are nurses, who are orderlies, who have qualifications, who are superior to that of the soldiers. My first question is for Dr. Arruda. So you are confirming to us that you had none of the data of the INSPQ when the deconfinement of Montreal, it was recommended that they be postponed? And also, I'd like to hear you on the analysis and conclusions that you draw from those projections. Okay, you have to understand that I had seen the initial work. And I wish to tell you that the decision that we made for the postponement in Montreal to the 25th of May is not associated only to the scenarios. The scenarios came to confirm the R0 and the R1 outside. That's based on the epidemiological data that we collect. And if you allow me, I would like to clarify one thing that's very important, and we're going to make sure that you have this graph regularly. The deaths, when we said over the weekend that there was 140-some deaths, those are deaths that were declared that day. But when you look at them, some were from the beginning of April. They had not been put into the system for all sorts of reasons, detailed confirmation, etc. So that the death curve, and we're going to make sure that you have these, but yesterday, there were 12 days on the 10th. There were 27 on the 9th, 12 on the 8th, and it goes up to the 12th. Goes back to the 12th of March, the number of deaths that appear retrospectively, so that the death curve goes up here. The gray zone here corresponds, and perhaps you can't see that, but the gray zone here, and we'll make sure that you have it tomorrow, the gray zone here corresponds to data that will probably be coming in over the next few days, so that the death curve already has a downward trend. So what I wish to say with all that is that the scenarios, we'd seen them already. We had talked about them already. There are hospitalization models, etc. They take into account certain data, but they don't take into account the deconfinement predictions that we could make. What it shows is how the behavior, outside of Quebec, regardless of what we do, the scenario, pessimistic, optimistic, because of the R0 that is very low, and that phenomenon, whether it be pessimistic or optimistic scenario, it's flattened, there's no problem. In Montreal, it's fragile. Depending on the change of social distancing, just a 10% less social distancing, that is, just means that we have an important effect on the curve. So it shows us as well that the collaboration of the population, when we say we're deconfining certain sectors, that doesn't mean that everybody can start, going out and moving around. That is what the curves are indicating to us in terms of interpretation. The curves are going to be updated, from what we've been told, once a week. So, it will even take the data of last week to be able to have a scenario that doesn't vary as much. So what I propose to you, because it hasn't been a question that was planned or anything like that, we had seen them and we did it with a scenario beforehand. We'll be able to have a technical briefing to explain to you what the scenario is, the strengths and weaknesses with the authors. Eventually, he'll be able to give you the interpretation of all that, which is very complicated. Follow-up, Mr. Premier, since Quebec is still ahead of everybody else in terms of deaths and cases, is it still possible to say to Quebecers, and more specifically to Montrealers, things are going to go well, ça va bien aller? Well, listen, we see that in regions outside of Montreal, things are going better, and we believe that with the social distancing efforts and confinement efforts that took place in Montreal, and we can see it with the graphs, that the situation is stable at the very least in Montreal, and we hope that it will be improving. And anyway, when we look at the curve in countries that started the crisis about a month before we did, well, it's improved quite a bit. So I have confidence that over the next few weeks, because it's going to be 1, 2, 3, 4, 5 weeks, that the situation will improve. That is going to go well eventually in Montreal. Both my questions are to Dr. Arruda. You talked about the deaths, Dr. Arruda. I'd like to have a breakdown for the places, because there were 200 over the weekend and 85 today. Where did these deaths take place? In the general population or residences? The vast majority were people who lived in CHSLDs. I can give them to you. Hold on, I'll look at the numbers here. 54.3. That's cumulative, or you want to know yesterday's? The weekend. The weekend? Yeah, the weekend and today. Okay, hold on one second. Over the past 24 hours, 50% came from CHSLDs, 12.1% hospital, 7.7% at home, 4.4% in RIs, 23.1% in RPAs, and 3 unknown for the time being because the information has not been entered. When you went to Montreal on Friday, Dr. Arruda, were you aware of the INSPQ study? Whether I was aware of it? Well, I was aware, and I had seen preliminary versions. But did you know that they were going to announce that there was going to be 150 deaths? I knew that they were going to be publishing their scenarios, and 150 deaths is a question in that scenario that's a little bit difficult. But the reason why I went to Montreal on Friday was that we were launching the new screening program in Montreal Nord with new methods, with the mobile buses, and I wanted to be with the directors for public health and the Montreal community metropolitan area because it was a new intervention that we're bringing to the community. So you weren't aware of that? I hadn't seen the latest version, no, the final version as such. But I knew that they were going to be publishing a study, as we had said, that, from now on, rather than using the scenarios that we had, that we did with another method, it was going to be that that the Institute was going to set up. Are you, playing with words here? If there was preliminary work to be done, the numbers, you knew what it was about, more or less. And the Premier, I imagine, was informed of that, at the very least a little. Mr. Premier, you're saying no with your head. You were not at all aware of even the preliminary work or anything like that? The discussions that we had over the deconfinement were based on the indicators in the number of cases, what was going on in hospital settings and intensive care, etc., and the information that there was intense activity in Montreal Nord. It didn't have to do with the scenarios. It's not the scenario that made us decide to do anything to do with the confinement. I'd like to talk about Montreal because you announced that there's already more screening being done in Montreal. What is the diagnosis of what is going on in Montreal specifically? Because you talked, Mr. Premier, as well about the two different worlds, CHSLDs compared to the general population. But what is it now? The results of the tests that you made to measure the state of contagion in Montreal, what's going on there? Well, I can tell you that there are tests that are being done right now, but there is an analysis of all of these tests by the Montreal people to tell me, well, these many cases are asymptomatic contacts of cases of people who were healthcare workers who worked in such and such a place, but I don't have that information yet. It's going to come over the next few days. What is it with the community transmission in Montreal beyond what's going on in CHSLDs? Well, the information that I have is that there's transmission probably that is more active in the hotspots. For example, there had been some in Côte-des-Neiges and in the Montréal Nord region as such. But if you tell me, with the tests that were conducted over the past 5 days, the analytical breakdown I do not have. But we do know that because of the fact that the number of cases is more concentrated in certain territories, with hot zones, as you can see on maps of Montreal, there probably is active transmission there. But is it active transmission acquired in the community, or are they outbreaks associated to people working in the healthcare sector? That's what I don't have as information. We are now going to go to English questions.
Good afternoon. Quebec is the hardest hit province by the COVID-19 virus, and Prime Minister Justin Trudeau on Saturday has repeated that today he's worried about his own riding, Papineau, in Montreal, and he said also that Canadians across the country will be very careful looking at what all orders of government are doing, and that if they are taking their decisions too quick, and that force Canadians to go back to lockdown again, well, you'll have to live with the consequences. You don't want to play that role now that the rock is watching you for many weeks, Mr. Legault.
Yeah, but first I want to say there's nobody who's more worried than I am about the Montreal situation. That's why we've decided to postpone the opening of the retail business schools in Montreal, in the great region of Montreal. So, of course, we all worry about the Montreal situation.
Concerning the mayor of Côte-Saint-Luc says that he's going to go ahead and make some laws, such as requiring building owners and condo boards to install sanitizing stations and require people to wear masks in elevators and in common areas, because he thinks the province is not acting quickly enough to prepare for the lifting of confinement measures in the Montreal areas. What do you say about this? The fact that, like, the mayor of Côte-Saint-Luc will have its own laws because the province is not going quickly enough for him.
Oh, okay, look. I say that even Côte-Saint-Luc is part of Montreal. In fact, we did recommend, and we are recommending strongly, that masks be wear if somebody cannot respect the 2 meters. And if you go to stores where you're going to be in interaction with people, and probably there is not be able to be 2 meters, that we will recommend the couvre-visage. So I think that's perhaps the mayor is also thinking that we are not recommending it. We are strongly recommending it. Last Friday, when I was outside, even if I would try to have the 2 meters, there was a lot of journalists. They were all together. So I wear a mask. When I'm going outside, now I'm wearing a mask if I think I will be somewhere where I'm going to be in contact. It's clear the first thing is the distanciation, which is the first thing. But if it's going to be part of, I would say, a new etiquette respiratoire. We ask people to cough here. Now they can have a mask and cough inside of the mask. But still, I will repeat it again, you use a mask, you have to wash your hands also. That's something like this.
C'est possible pour vous de répéter en français votre réponse?
Could you repeat your question in French, because it is important? Well, in fact, what has to be understood is that the mayor of Côte-Saint-Luc has the impression that I'm not recommending the use of a mask outside. I want to be quite clear. Côte-Saint-Luc is within Montreal, but for everything, even outside of Montreal, where people can think that there might be a period where they won't have the 2 meter distance, they can wear a mask. And I think that you know that the mask is to protect others, it's not to protect yourself. It's going to be part of the new respiratory etiquette that rather than coughing in your elbow, you wear a mask, quite simply. If you go outside, if you think that in certain periods you won't be able to respect the 2 meter distance, of course, if you cross somebody, quickly, the risk is very low, but why not wear one? Wear it correctly, of course. Don't wear it on your chin. That's useless. But also, don't forget to wash your hands. So we strongly recommend the use of face coverings right now in the context where we're starting to deconfine, where the virus is going to be around for a while until we've found a vaccine or it disappears on its own, which is not very probable.
Just to follow up on Mr. Laforest's question, a lot of people in Montreal had a very stressful weekend. They were very worried. There were a lot of scary headlines and scary stories about the spike in cases and deaths as a result of the Institute study. Now, you said you were aware of the preliminary data. You knew that they were going to publish them Friday. You said that in French.
I knew that it was going to be published soon. Friday or when exactly, okay. I didn't know it. But
why you had a whole news conference in Montreal, a whole event. Why did you not discuss those numbers at that time? Why would you hold back that information at that time when you knew how dramatic those numbers were?
Okay, first of all, I didn't want to make people get anxious by not telling anything. The objective of my press conference in Montreal last Friday was about the new screening aspects of this, and I was not aware And I just want to make sure that I was not aware that this was going to be so explosive as data, because also I would say we already had decided to postpone to 25th of April to 25th of May at least, because of other reasons, and probably I didn't realize that this schema, which was the worst scenario, would be interpreted as what is going to happen, because in fact, it's only based on a scenario if we do deconfine but don't put in place the different sequences. So it's only on the Saturday when I saw the press that I realized that that was focusing. And I just want to say also, which is very important, that even if we declare 142 people dying last Saturday, those ones were dying from the beginning of April. So it was not, as today, it's not 985 cases that was there yesterday. That was, in fact, 6 cases that were there yesterday, because they all are distributed through, I would say, 1st of April till of the end. And for that, we're going to make publishing, and that will be great for you to have the people who die. When it's declared 100, you will see that that's not 100 on the last days, but it's going back earlier because of the declaration time.
There is criticism of your Premier of letting the whole weekend go by without those numbers floating out there. Should you have responded sooner to calm people's fears as a result of those numbers, Premier?
Okay. First, every day we show the figures, the new figures, the updated figures. So if we look at results, we give you 100% of the information. Now we're talking about projections. Projections if we open the retail business, if we open schools in Montreal, then the INSPQ, they say it will be an explosive if we open. So it just confirmed that we took the right decision to postpone the opening of the retail business and schools in Montreal. So just confirmed that we took the right decision. And we still have 2 weeks in front of us, and if the situation is not getting better in the next 2 weeks, we'll postpone the opening of May the 25th. So it means that the scenario that was shown by INSPQ will never happen. It was only a scenario if we decide to open, which is not the case.
And if you don't mind, may I add, please, if we decide to open with no other measures inside, it's clear in the data. And you know the problem of those graphics and probably of those scenarios with no mise en context by the experts to explain the limits and what does that mean. So, and I think there's going to be, I just want to announce, there's going to be new scenarios because they are made, I would say, once a week, almost once a week. Next time, I think it's going to be, if you are okay with this, we could have a technical briefing for you to understand what does that mean, because this is important issues, especially to calculate the air zero and air one is important, but for the projections, there is too much hypothesis with no action that makes it could happen, that thing, like we have aplatir la courbe before, and it's clear we will never let things go up that way.
Okay, peut-être pour répéter en français.
And maybe just to repeat in French what I said in English. Since the beginning and up until now, all the information on the results, whether it was the number of cases, the hospitalizations, the deaths, all the information that we have, we disclose it. What we got in the INSPQ report on Friday evening was a scenario where what was being examined is what would happen if we opened retail stores, schools, and daycare centers in Montreal. So they were saying, if you open retail stores, daycare centers, and schools in Montreal, there will be an explosion in the number of cases, hospitalizations, and deaths. So it came to confirm that we had made the correct decision in postponing those openings to the 25th of May. So the INSPQ basically came and said, you did well to make that decision. But what is important to say is that the scenario that was filed by the INSPQ won't ever take place. It won't take place because we decided to not reopen businesses and schools, and we won't open businesses and schools on the 25th of May if the situation is such as it is now. So the scenario is a hypothetical scenario of something that will never take place. Thank you. And for everyone's benefit, perhaps also for Dr. Arruda, you were saying had not apprehended the reaction, the amplitude of the reaction. Yes, what I was saying is that people reacted a lot to the scenarios, and it created a lot of concern. When I did my press conference on Friday, I knew that the Institute was going to be publishing things. I mean, there's many graphs within that one, and I don't know which one, I didn't even know which one was going to come out because there's different scenarios. There was one that shows that since Montreal is very fragile, that if we were to apply a deconfinement without any control measures, because when we say deconfine, is that we're deconfining and leaving people move around in quantity without intervening on eclosions, without doing any screening tests, etc. So we would end up with a very important, but what I did not realize at first, on Friday's press conference, my purpose was to explain the new screening program in the metropolitan area. I went to Saint-Michel. I went to see a homeless shelter. I went to Laval to see the screening centers there. So I didn't get back to that. It is only on Saturday that I saw that it had created a lot of disquiet. And I don't know if we talked about the curve in French. Did I talk about that in French? Yes, I said that. Okay. Thank you.
Hi. What is the government plan to increase testing for asymptomatic people who want to test, like, for example, the CHSLD's workers?
It will depend on the capacity. It's clear actually we are going where there is symptoms, and I would say if there is a case, we will test asymptomatic people around the case. If if it's a big CHSLD, it could be around 2 stairs or 1 stair, depending where is the zone. And actually, we would like to test probably close contacts, asymptomatic of cases, to be able to do that. And when there's going to be, and there is an issue to test everybody asymptomatic because you have to repeat and repeat and repeat. But that's going to be part of the analysis we're going to do when we're going to have more capacity.
Okay. And you said earlier that one of the reasons for our number of deaths is high in Quebec is because our method of counting is different. Why don't we use the same methods as everywhere else to compare and to be like on the same level to
I think that's a good question because, in fact, it's better if we've got the same definition to compare in numbers. But in fact, we wanted to be like, I will say, when we call it lien épidémiologique, I mean, we confirm them because if you have the disease, your test is positive, I've got almost the same symptoms, but I've not been tested. We are not waiting for having the tests. We are taking that I'm a case too. So in other provinces, and it depends, they call it probable cases. They don't count it. They only will report on confirmed case. That's a different strategy. But because we want to have I would say, a different picture, and I don't know, I don't want a different picture or more, I would say, proche of the reality, we decided to count them. It's like, I would say, I did give always that example, people who die from heat waves, we decided if somebody has decided and probably there is a relationship with health wave, we're going to count it as a case, and other provinces will wait before the coroner is going to do a report. That will take months.
And I would add that some specialists, what they say is that when we'll use the method that is called excess debt, which is to compare the real number of debt to the average of the same months the preceding years, will be closer to reality in Quebec than in other countries because of that, because we declare truly all the debt that are associated with the COVID-19.
Thank you. And now, two quick last questions from Raquel Fletcher, Global News. We're seeing outbreaks in neighborhoods like Park Extension, Montreal North, Verdun. What is the strategy for containing those outbreaks so it doesn't spread to other neighborhoods?
But it's going to be the search and contain approach. It's looking to have those outbreaks identified by case catching, making sure that the contacts are aware, put them in quarantine, and follow up with them if they develop some symptoms, and make a specific inquiry to know exactly where the cases have been through to detect others and put them also in quarantine, and don't let people who have been in contact with them free on the field.
Thank you. And as a very last question, McGill and Université de Montréal have announced they will teach online in the fall. Is that a sign that all schools should be virtual in the fall?
No. I think we'll look at this situation. We hope that there will be some teaching that will be done physically in universities and colleges and schools, but we cannot confirm if it will be possible today. So probably during the summer, we'll have announcements to make.
So thank you very much. C'est ce qui complète pour cette conférence de presse. À bientôt.
This puts an end to the press conference. Thank you very much.